So today we have a guest who is passionate about sonography, but even more passionate about educating and mentoring those entering into the field. Like most of us, her initial career goals didn't include what she's doing today, but through research and volunteer work, she was led to exactly where she needed to be in sonography. With 12 years under her belt, she's dedicated her time to education and the specialization of breast, abdomen, OBGYN. So today I bridge the gap between nurses and sonographers. So let's welcome Jess, the Sono Girl, to the Evolve Nurse Podcast.
Thank you. Thank you for having me. I'm so excited to do it and, talk with you about everything. I think your platform is great, Lakeisha. I love everything about the Evolve Nurse. So I kudos to you and thank you for having me here today to kind of talk about sonography and kind of get into a few things.
Yes, because it's one of those fields where people don't know that they can dive into. So let's get right into it. So did you we already know that you didn't want to be a sonographer, but how did you find out about it?
Okay, so it's the most random story. So of course I went graduated high school, went to college. Nobody really tells you what to do when it's like almost time for graduation. So I'm ending my college bachelor's degree of science. I knew I wanted to do medical, something in the
Mhm.
medical field, but I just didn't know what. And like a couple of months before graduation, like I'm hearing everybody, talk about going to nursing school and PA school and med school, and I'm just like, oh, was that supposed to be something I was supposed to be doing? Because I just been having a time in college and just trying to get my degree. So I was like, oh, well, I do need a job. I do need to work. So let me see what's out there. I knew I always wanted to do something in the medical field. I initially thought I was going to do physical therapy, but I did do like a little shadowing and I realized that I didn't really care for it too much. So that was my first path, physical therapy. And then I wanted to do like sports medicine, something like that. But then I was like, ugh, I don't want to work around stinky athletes all day. So what else we got? So I actually just started like Googling healthcare careers. And one of the things that I searched was something that wasn't going to take me like 12 extra years. I was
Yeah,
like,
because
I'm
you were
ready to
already in
get into
school
my
for
career.
4.
Yeah, right.
Mhm,
I was like, I'm ready to like finish. Like, I mean, you've been in school since elementary, right? Just continuing on. And I
mhm.
was like, okay, I need to do something that I'm gonna like and love and that's gonna have some variety because I tend to get a little bored. And once I like Googled and I'm like, okay, I don't want to be a nurse. I was like, I just don't want to do it.
Mhm.
I knew I didn't want to be a doctor. So like medical imaging kept coming up and mainly ultrasound kept coming up when I was doing my like Google searches and everything. So I like looked into it and because I'm in Houston, I was like, oh well, we have the medical center here. Has to be a ultrasound school program, and it actually was one at one of the community colleges. So I applied, and I was like, let's just see what happens. And I got in, and luckily, when I got there, I had no idea of anything in ultrasound. All I knew is babies. That's pretty
Mhm.
much it. And once I got into school, and I'm like, oh, it's like so many different varieties. You can't get bored. I did think that I was going to quit ultrasound at first when I first got
Okay.
into school, because I was like, I can't see anything. I don't know what I'm doing. What am I doing here? How
What
am
am
I
I looking at? I
basically?
don't know. I never know.
I was like, I don't see. It looks like fuzzy grays, and I'm like, I didn't
Mhm.
pick the wrong career, but I stuck with it, and I just ended up like being really good at it, and I just fell for the like passion of like helping people along the way.
Okay, I love that you said what you said because I think I've interviewed a few people and we all have the same story. We all went and got our bachelor's of I got my bachelor's in science and biology.
Hmm.
So it is a huge issue when you go into these biology programs and a lot of people go on the med track and they're not prepared when they get done with school.
Right. Right.
So if you aren't like hitting the pavement initially and know exactly what you want to do, you just do not know.
Right, right. And for me too, so like cuz I was like, okay, I want to do physical therapy. So I went to one of the schools and I was like, hey, let me just go and see what is the possibilities of me really getting into a physical therapy program.
Mhm,
And I met with one of the counselors at one of the schools and she like looked at me and she was like, I'm going to be honest. Like your GPA is good,
mhm.
but your GPA is not going to get you into this program. And I was like, oh, and I always been a great student, like number three in my class. I had all these honors, and to hear that I wasn't going to get in this program, she was like, you probably need to get into something else because this program for physical therapy is it's so hard to get into. So I was
Mhm.
like, oh, okay, wow. So it was very much a shock. And even in undergrad, I don't think I took it very seriously because I was like, oh, I'm a good student. Everything's gonna work out. I'm a great student. I'll be fine. And to hear that I possibly was not gonna get into this program that I had kind of, had my sights set on, I was
Mhm.
like, oh wait, well now what am I supposed to do? So it nothing prepared me for this career and this trajectory that I went down back then. Like nothing could have prepared me.
And we also have to speak to how hard it is for smart students in high school to transition into college because we don't have that security blanket. Like we
Mhm.
could do high school honors, all the things, and then once we get to college, it's a culture shock. You don't have your parents waking you up in the morning anymore. You are solely accountable for everything that you do. And in high school, you didn't have to study. Like
Right.
going to the test to make the A. That's just what it is.
Yes.
In college, you'll be like, hold on, I'm stressed out, I'm struggling. And I am very sad that that lady said that because there are so many students who can get into those programs with lower GPAs. And sometimes it's like a 3.0 GPA, and they're like, oh, that's too low.
Right. Right. And it
And
was
I say to
very
y'all,
shocking to hear that. Yeah.
yeah. And it does give you the fear around going for what you want to go to. So automatically you just start thinking of other things. So that's not
Mhm.
even on the table anymore after what
Right.
she said.
Right.
But
Yeah.
I speak to myself because I had a 2.73 GPA coming out of nursing school, and I got into my doctoral program, which required a 3.0 because of all the things like volunteer work, all of the things that I was doing. It made me look like a good candidate.
Right, 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 right. And I think that was one of the things that I didn't, and even now to this day, when I'm doing my mentorship and talking to like new students and everything, I'm like, it's a lot about getting these networking and doing like internships, getting into volunteering into hospitals, because sometimes it's not about your GPA. And for me, I didn't really recognize like the things outside of school that I should have been doing to kind of
Mhm.
get me on into these programs. And I was just like, okay, well, I'm gonna, get my degree because nobody really
Absolutely.
tells you to like, oh, go, join a club, go do volunteer, go do
Mhm.
these other things that's outside of the norm. So, it was, and even when I applied to ultrasound school, like ultrasound school is a very rigorous program, and it's a lot of it's really hard to get into. I think when I applied, I think we had like 200 students that applied, and like they only took 20, so like 10%.
Look at
Yeah,
you.
so
And
it's
the
even harder.
10%.
Yeah, and it's even harder to get into than physical therapy school. But it's just one of those things where I was like, okay, I'm just gonna have to take a chance on it and just go for what I know. They
Mhm.
saw something in me that apparently that they liked and was like, okay, you are a great student. We see something in you. I had a good interview with at the time with them, so they were like, okay, let's get you in the program. I'm like, y'all want me to do this?
Uh,
Okay.
already? Already?
Like, oh, okay, well, sure, let's go ahead.
Are you sure? Because you know that other lady said,
Right. I was like, well,
because
just
that's always looming in the back of your head.
yes, yes. I'm like, just down the street, the other school for physical therapy was like, you might need to do something else. And y'all were like, welcome, come on in.
Yes.
I'm
Thank
like,
you.
y'all sure? Because I don't know what's happening here.
And I'm glad that you found someone, a program that was open arms to you and made you feel welcomed. I think a lot of times in healthcare, what ends up happening is we get in the rooms and we don't feel welcome.
Hmm.
And that does a lot to our psyche, especially when it comes to testing and when it comes to confidence. Like you were seeing those fuzzies for somebody who would have had, you can't do this running in the back of their mind, you would have never been able to tell what the image was.
Right, right. And I tell that to my like students and my people, the girls that I'm mentoring now. I'm like, hey, this is when you get into these spaces, especially as a student, you're doing your clinical rotations, you are gonna have some sonographers that do not want to have anything to do with you. They
They
don't
think
want
you're
to
going
help
to take
you.
their jobs.
Yes, and that was so crazy. And even for me, I did experience it a few times, but I was like, I just want to learn. I want to be like you. I want
Mhm.
to know the things that you know. I'm not trying to take your job. Like, my path is my path, yours is yours. But me now, I'm at this point where I've been in this for 12 years, and I tell anybody all the time, like, if you feel like you want to figure out how to do sonography on the moon, okay, I
Moon
don't know how we're
sonography.
gonna get it, but I'm gonna figure it out for you. Let's go. It's Nothing is gonna hold me back from just helping someone else. And
Mhm.
it's very sad in healthcare for sure that we don't have a good mentorship program sometimes. And it's hard to get to certain points and you're like, I just need help, but nobody wants to help you, or you don't even
Mhm.
know how to ask for help. So I always try to make myself available for my students or for anybody, even on social media. People reach out to me all the time. It's like, hey, can I interview you? Hey, I'm trying to get into ultrasound school. What do you think? And I'm like, yes, let me tell you
Mhm.
all the things. Let me give you the rundown. If you need me in ultrasound school, call me. Let's talk about it. Let's, get through these things, because I didn't have that. And now I feel like I'm at a point where I can give back to, our new students and our people, our sonographers that's coming into the program, or anybody in healthcare, really.
So you just mentioned that you do mentorships. So for people who are listening here right now, how would they get in touch with you and navigate starting a mentorship with you?
Yeah, so I've been kind of new to this mentorship portion,
Mhm.
like for officially. But just reach out to me on social media. I'm on Instagram, TikTok as Sono Girl Jess BR. So all on Instagram. Just send me a message. If any questions about ultrasound, medical imaging, anything like that, I can try to help navigate and get the person to whatever questions they have, get them to any other resources. If I'm not a good resource, I can find somebody that can kind of help.
Okay. 1 second. Okay, so you have been in sonography for 12 years. What, outside of what you just told me about sonography school, what were some challenges that you came up and faced during that time?
Whew. I think one of the hardest things outside of like sonography school and preparing for your boards and the education part of ultrasound, I think the hardest part was the patient interactions.
Mhm.
And so I worked in the hospital setting first before I started doing just totally breast ultrasound. And working in the hospital setting, you're going to come across a little bit of everybody. Of course,
Mhm.
you're going to have your inpatients, your emergency room, your outpatients. You're going to have patients with varying emotions and dealing with the patient's family, and also a plethora of doctors that they're sending orders for. And you're like, this order doesn't make sense. And the patient is looking to you to have these answers to these questions. And as the ultrasound tech or the sonographer, we can't tell you results.
Yeah.
So they patients would get upset, they would get mad, they would get angry, they would cry. And that really like broke my heart to feel like I was feeling kind of defeated in it,
Mhm.
because I'm like, wait, I got into this field specifically to help people, but in the moment that the patients are most vulnerable, I can't really help them because I
Mhm.
can't say anything. Like it's And so I'm like dealing with I remember one time I had a mom, and it was like a Friday evening, and she brought her son in because he was having right lower abdominal pain. And they of course wanted to rule out appendicitis. And
Mhm.
he is like kicking and screaming, and he's not holding still, and it's just a whole thing. And I was like, let me go get another sonographer to kind of help hold him and kind of keep him steady so we can at least try to get the pictures. It was positive, and the mom got mad at us for like holding him down. And I'm
Yeah.
like, well, we had to get the pictures. Like you came to the hospital, you want to help for your son. So, we want to help him. We're not trying to hurt him. We're not trying to make this worse, but we have to do our jobs. And as I was taking her back down to the emergency room, she just looked at me and was like, "Do you have kids?" And I was like, "No." And she was like, "Well, you just don't know how it is as a mom to have to deal with a child that's in pain."
Yeah.
And it like a light bulb just went off in my head, and I was like, well, actually, just because I don't have kids, this makes me want to help your son even more because he
Mhm.
is in pain. Like he is screaming and I do see his pain. I don't and I told her, I was like, I don't want to hurt him. Y'all came here for a reason and I want to help him. And it was a very awkward
Yeah.
elevator ride back down. And once I like put him back into his room and she like stepped down, she was like, you know what, I'm sorry. You really helped him and I understand that, it's just seeing him in pain. And I was like, no, don't apologize. You're a mom. I get it. But as the ultrasound tech and somebody who's here to take care of your child, that's all I want to do. That's the only thing I want to do. I don't want to hurt your child. I want to help them. I want to help you. So dealing with like the patient's emotions and the family's emotions sometimes, that was like the hardest thing that I would like take that home with me. And I'm like, could that interaction would have went better? What do
Mhm.
I do for my next patients that are angry? And I'm like, and it was no right or wrong answer because every patient is
Yeah.
going to have a different emotion. They're going to have a different feeling. Some are like nonchalant and not have a care in the world, and others are in there terrified. So I
Yeah.
kind of had to learn how to be really good at making sure my patients were comfortable, even though I couldn't tell them anything.
Yes, and I think that's the same thing we deal with as nurses because we can't tell diagnostic information. And our our patients are often wanting to know, and we're like, we'll refer back to the doctor. We'll get the doctor in here to speak to you. And they're like, why you can't tell me? And they often will like misidentify us as being doctors. And
Hmm.
so then they want all the answers. But that is the reality. Like we're working within our scope. And in our scope of practice, we can't give you the diagnostic information because the reality is they were taught to read that.
Right.
You were taught to read it as well, but they were taught it in detail.
Right, right.
So
And
they have the words.
I would tell patients, they'll be like, but so do you not know what you're, so that means you don't even know what you're doing and you don't know what you're looking at. And I'm like, actually, I do know what
Mhm.
in my head, I can't say this, but I'm like, well, actually, I do know
I know
what I'm
what I'm
looking
looking
at.
at.
I get it. I just can't tell you. But and
Yeah.
I would often like even with patients if they were like really jokey about it and like making fun of it. I'm like, well, I didn't get paid the big bucks to be the doctor to read it. I got paid the ultrasound bucks to do this ultrasound. So
Yeah.
this is what I went to school for. They went to school what they went to school for. We're here to help each other out. But
Mhm.
yeah, a lot of times with the patients, they'll just be like, okay, you just don't know what you're talking about. And I'm like, actually, no, I know,
Yeah.
I know a lot.
Yeah.
Actually.
So, what are some steps that you think that people who are wanting to go into ultrasound school or become an ultrasound tech, what are some of the first steps that they should take?
So one of the first things I think if you really want to do ultrasound, I tell this to anybody that's considering it, go into a hospital setting and try to do a volunteer opportunity where they can actually put you into a medical imaging department. So
Mhm.
that way you can see all of medical imaging and how ultrasound kind of fits into this puzzle of x-ray, MRI, CT, all of those imaging modalities. I also say get into a volunteer program at the hospital because just in the event you want to do ultrasound or think you want to do ultrasound, and you feel like it's not for you, you didn't just waste your time trying to do ultrasound school. So doing
Mhm.
volunteer work in the hospital can kind of actually put you into different little areas so you can see different fields of healthcare. So that would be the first thing I think to do is to try to find some volunteer opportunities or shadow a sonographer.
Mhm.
I know a lot of times with the OBGYN sonographers, like outpatients, I think they do a lot of shadowing for students because they are a little bit in a more relaxed environment, so they can kind of have a someone come in, a prospective student come in and kind of just watch them, see the daily workflows, see kind of what they do, and kind of see what the day in the life of a sonographer entails. I think that's super important because we see it's being glamorized on social media, like, oh, be an ultrasound tech and you'll
Yeah. Make
scan
some
babies
money.
all day and make
Yeah.
all this money. And I'm like, yeah, but it's other things that come along with this. And if you're not like prepared for that, then you've just, kind of wasted your time. So definitely I think getting into a ultrasound program or even getting into mentorship, like with me,
Mhm.
or reaching out to so social media has a lot of good sonographers that reach out. If you want to get into the field of sonography, like talk to someone so they can give you like real deep insight, because I didn't
Mhm.
have that. I was like, I'm just gonna go to ultrasound school. It'll work itself out, and
You
that'll
used
be
Google.
fine.
Google led you to where you needed to go.
It did, it did,
You
but
know.
Google didn't tell me like the day in the life,
Exactly.
the schedule. I was like PRN for like 3 to 4 years. So I didn't have insurance, and trying to figure that whole thing out by myself. And I'm like, nobody prepared me for that. And I was just kind of like, let's just try these. Let's just grasp at straws and see what sticks. So that'll be one of the things I think to get into, like a volunteer program or reach out to a sonographer, so that way you can get that mentorship, so they can help kind of guide you, because the field is so vast. And we often think ultrasound is just babies, and it's not. It's
Hmm.
vascular, it's heart, it's breast, it's MSK, it's all these different things that encompasses this one field. So that will be one. And what was the question again?
I think that was it.
Oh, okay, okay,
I think you answered it fully,
okay.
because the thing about it is I've had to do that. And I think in all healthcare, if you ever feel like it's something that you want to do, go and shadow.
Yes.
And it might take a little bit of work. You might need your resume, some paperwork, going down there to the hospital, wherever. We had to hit the pavement hard. And I always say we need to bring back resumes, like going door to door with your resume and letting them know, hey, this is who I am, this is what I want. And if that's something that you really, really want, go for it.
Right.
As she said, those opportunities are there, but you never want to be the person to be like, you know what, I actually don't like this
Hmm.
after years of school.
Right. Right.
After years of school and then years of being in the field, and now you feel like there's nowhere else for you to go because you've done all this work to become a sonographer.
Right, right. And even I think even for me, I always knew when I started like my first year in ultrasound, like I'm a big girl, I've graduated, I'm on my own. I was like, okay, 10 years, that's it. Like 10 years, I'm gonna be doing
That's how
something
you can
else.
give.
I was like, 10 years, I'm gonna be out. Like, I don't know what is gonna happen, but 10 years I'm out the door. And the only reason I gave myself a 10-year window is because I was like, that's gonna let me know if I truly, truly love this and really like this as something I want to do for the rest of my life. But also they were talking about recertifications and taking all our boards over again in 10
Mhm.
years. And I'm like, it's no way I'm gonna remember the things that
Any of that.
did. No, I don't remember things I did yesterday. You talk about something from 10 years ago? Absolutely not. So I was like, yeah, if that happens, I'm just gonna have to find something else to do. But I do think that ultrasound is one of those fields that, because it's so much variety, you can find the thing that fits you. But also too, ultrasound is hard. It's not the x-ray, it's not CT, it's not the machine making the images. You as a sonographer are making the images. So that's
Yes.
another thing that kind of comes into play as well during training, is like knowing that you as a sonographer, you're the one that's making these pictures. So whatever you image, that's what the radiologist has to depend on.
And I think that I'm glad that you said that, because I'm always looking at a sonographer come in, ultrasound tech come in, and I'm like, okay, so what are you doing? Because we have no idea. We just know that we gonna help you move the patient over. We're gonna help you get to where you need to be. And then all of a sudden you're like, oh, okay, we need them over a little bit more because I can't see the kidney here. I'm like, okay, whatever I can do to help. Whatever I can do to help, because we really do not know. And that's why I want to bridge the gap, because it's a lot of things that we don't know about each other's career paths. And sometimes we're like, oh, we have nurses who'll be like, I'm not going to get him the ultrasound right now. I'm busy.
Right.
No, sometimes you need to take the time to go, because that could be life or death for some of our patients,
Right.
especially like that child who had appendicitis.
Right, right. Yes, exactly, exactly. And let me just say this: as a nurse, I love our nurses that will come and help us. I'm like,
Mhm.
hey, can we roll him? Hey, is it okay for us to come in? Because some of the nurses will be like, I don't just, yeah, he
Go
ain't got no help.
ahead.
And I'm like, okay, no help
It's
over
like,
here. Okay, so I do thank you for helping us, because sometimes like rolling them or getting to the other side or moving stuff, like I loved all our nurses that would like really help us and be there, like, and they'll be like, hey, is there what do you see? And you're like, oh, this is like the pancreas in here,
mhm.
and kind of explain the thing. So first and foremost, thank all our nurses that definitely help, because it
Yeah.
definitely makes our job as an ultrasound techs way easier, for sure, for sure. But yeah, I think that we do have to kind of bridge that gap between us, because we work so closely together, we depend
Mhm.
on each other. It's been numerous times where I'm like, hey, calling downstairs to the, or hey, is this patient ready? The labs look kind of incomplete. Are y'all ready for us to come and get them? We have to have that communication and knowing what each other is doing, so that way
Mhm.
we can kind of know, like, oh, I know that this patient is in ultrasound. It's probably going to take 30 minutes for their kidney ultrasound. And telling and communicating as ultrasound text to the back to the nurse, like, hey, I'm gonna take them for their kidney ultrasound. We're gonna look at the kidney, liver, gallbladder, or whatever we're looking at. So that way, if the doctor comes up or if a family member comes up, the nurses that's taking care of the patients knows exactly, kind of like, hey, they went and took them for ultrasound. It's going to be like 20-30 minutes. They'll be back up. So different things like that, I do think is beneficial for us to kind of bridge the gap of everything that's happening, because we do cross paths so much.
Yes. And I think that's important for that is true continuity of care.
Mm-hmm.
Like we always talk about continuity of care, but if we're not communicating with each other, then something is going to get lost.
Mm-hmm.
And
Mm-hmm.
then you'll be trying to figure out where are the images, where's the patient,
Right.
has
Right.
the patient had
Exactly.
anxiety meds, like what do you need? A lot of things go into doing the work that we do that
Mhm.
many people don't recognize how closely intertwined we are.
Yes, yes, for sure, 100%. And also too, something that we kind of talked about. I have been seeing kind of an influx of nurses going into ultrasound school.
Mhm,
And I've been one of my ultrasound techs that I've been on for a couple of years. She wants to go into nursing school, so I've
mhm.
been seeing kind of this, kind of back
Yeah.
and forth. And I'm like, which is good. I really love to see it. And I asked my friend, I was like, well, what made you want to get into nursing school? And she was like, I always wanted to do it, but ultrasound just kind of came up, and I just kind of went with it. And another nurse who was going into ultrasound, I was like, well, what made you want to pivot into medical imaging? And she was like, I always see you guys do it, and it looks so interesting, and I want to be
Mhm.
a part of it. And I'm like, it's really good that we do have this like connection where we can kind of see our jobs kind of cross paths, and you're like, oh, what is that? Oh,
Yes, like the curious nurse, like
yes.
the we always wanna know what's going on,
Yes.
what is it, can you tell us? Like, I be at the field asking the surgeon, "So what are we doing right
Yeah.
now?"
That's how I'm used to say. When I used to do surgery cases, I'm like, I should have been like a surgical tech or something. Like, this is interesting. I'm like,
Yes,
what is that you're doing over there? Oh, you're okay. What is okay? That's, oh, yep, that's the brain we see. Okay.
and when you have really good surgeons, they will tell you everything they doing. They
Yes.
will they will stop and tell you everything that they're doing. And just like nursing, I always say that everybody looks at nursing as something to go in the healthcare field if you don't want to be a doctor.
Right.
But there are so many other valuable jobs in
Mhm.
healthcare. And if
Yes.
you love people and you care for people, and your reason for going into healthcare is because you care for people,
Mhm.
nursing isn't the only area you can do that.
Right. And I think, that's something that I often like say. I'm like, nursing is not the only
Mhm.
avenue in healthcare. Ultrasound is not even the only avenue in healthcare. Medical imaging period is not the only thing. I'm like, X-ray, CT, MRI. I'm like, those aren't the only things as well. I'm like, you have
So
lab techs, you have phlebotomy, you have the pathologist. I'm like, and I didn't know that this world of healthcare was so vast. I only knew like nurses, doctors, and then like medical imaging. And that's why
mhm.
I often tell like anybody, I'm like, hey, if you want to really do healthcare, like try to get in volunteer, because you never know. Like you might want to get in the IT side of things. Um,
Yes.
Healthcare security with like IT is like such is big now, and I'm like, it depends on how you want to be there and show up for your patients. Because I'm like, being an ultrasound tech, you are definitely, and a nurse, you're definitely patient facing all
Mhm.
the time. You have to be on like all the time. So I'm like, if you don't want to be in front of people all the time, and your social battery gets drained,
Right.
this is not this is not, especially in breast ultrasound. Like, you're so close to your patients because you see them so regularly.
Mhm.
Either we see them, if they get, a call back and then they have to do a biopsy. We see them like, within a 3 week or to a month time span. We might see them in 6 months, every 6 months, for like follow-ups. Even if they have like breast cancer surgery, we might see them 3 months, 6 months before their year. So you see these patients and you kind of get this bond with them to get really connected. So
Mhm.
you very in ultrasound, it's very like patient facing. Breast ultrasound for sure, because you're with your patient a longer time than I think any of the other modalities. And OBGYN, I think, because you see those patients repetitively until they, have their babies. You with them. They like become your family. You see them all
Hmm.
the time. They just, and if you don't have that in you to be with the patient all day, every day, even on the days when I was tired, I'm like, I just want to just not sit in my bubble and not talk to anybody. I'm like, nope,
Yeah,
my
but you
my
can't.
job is to help people, so
Hmm.
I have to do it.
Even when it's hard, I say
Yeah,
that all the time. Even when it's hard, it's like we might have had a patient who passed away over here, and then we have to turn the tears off, turn the smile on, and go into the room for the next patient.
right, right. And
So,
that's something that I feel like only if you're in healthcare, only healthcare people will understand, like, oh, we just saw something or just got the worst news for this patient that, we've been caring for. And then you're like, okay, but wait, two more patients just came. Now you
hello.
switching, you're like, okay, suck it up, okay, get and good to your next patient. And that was one of the things too that I had to kind of learn, was to like, okay, this is a very emotional job, but I can't
Mhm.
take the emotions to my next patient, and I can't take the emotions home, because every patient needs me to show up as my best for them when I get them.
So you said that you had a hard time in the beginning because you were taking all of your emotions home with you. How did you work through that?
I started to figure out how to do things outside of work to kind of decompress. And also I started making like boundaries. When I got out of ultrasound school, I was like, okay, I got student loans was about to hit. So I'm like, oh no, I gotta work. I need money.
Mhm.
So like I took all the shifts. I did all of like late, holiday, early morning. Like I took all the shifts and I took calls. So I worked so much that I don't think I had time to really like process,
Yeah.
like setting myself a boundary to say like, hey, you're going to get burnt out, hey, you're going to get tired. So even at the end of my shift, I would go home and I'm like, okay, I didn't take this picture. Did I do this for this patient? Did I
Hmm.
call a doctor? Did I put in my paperwork? And it would just eat at me. So I would have to like, when I'm like driving home, I would like use that as my decompression time. Like, okay, whatever happened, you did exactly what you were supposed to do for the day. Is nothing else that you can do further. I would have to go like either work out before my shift. So I would like get into the gym. I started doing kickboxing classes, going to the gym like 3 or 4 days a week just before work, just so I can just mentally like prepare for the day. And then setting myself to say like, hey, okay, you've been working. It's time for you to take some days off. Get away from. Don't worry about what's going on when you're not there. Don't go back in early just because you feel like you missed something and you're trying to like catch back up. So that was one of the few things that I had to do to really like disconnect and say like, okay, whatever I did for that day that I was at work is done. There's nothing else I can do for that day. It's a fresh day, a fresh patient that's gonna come tomorrow, and I have to just let it go. So I kind of had to kind of get over there, and also started seeing a therapist. Like my therapist really helped me to like say, okay, Jessica, you're gonna burn yourself out. You're gonna run on empty, which I did start to kind of experience that burnout feeling.
Hmm.
Right before COVID, I was like, I don't want to do this. I feel like I was just on this hamster wheel, and I'm like, I'm tired. These patients, everything was kind of like weighing on me. And talking to my therapist and finding things outside of work to kind of help get my mind off of it was the best thing for me.
I'm glad that you said that because so many of us in healthcare go through so many things. And as a nurse, we would have never thought that you all go through so much.
Yeah.
Especially, and then I'm like, of course they go through a lot. Like imaging, of course
Yeah.
you're seeing patients at their best, at their worst in life, sometimes in death.
Hmm.
There are a lot of emotions that come along with that. And like you said, that burnout will get to you, especially with you picking up all the shifts, doing all the call,
Right.
being available. I remember when I first picked up a shift outside of my 3 a day, like my 3 a week. I
Yeah.
was like, hold on, my body don't feel right. I was like, I can't keep doing this.
I know it was when I started doing, once I got into breast, we went down to 4 days a week. And I was just Monday through Thursday. And I was like, oh, this is nice. And then I picked up like a Friday. I'm like, wait,
My
hold on,
body.
because I don't think my body was I need my 4 day weekend, because I can't get back
Yes.
to Monday and be okay to start feeling like my week didn't end from last week. I felt like I was just carrying the week to, and I was like, okay,
Exactly
no,
what you did.
4 days, 4 days, 4 days is enough.
312s was up.
Yeah,
312s, that's all I can do. 312s on night shift, that was all I could do.
yeah,
That
I
fourth
believe it.
that fourth day, I said, "Hold on now.
It gets different. You like, wait, this because you're in your head. You're like, it's just an extra day. Like
It's just extra
I
day."
do
And
get
other
it.
people do it all the time.
But yeah, but it's something I don't know what it is, but that extra day is very it's a make or break point. And then I'm sitting there, I'm like, I'm not doing this ever again. Why did
Like,
I
why
agree
did
to
I do
this?
this to
Why did
myself?
I agree to this? Yeah, I'm like, dang, why did I do this to myself? Like, is the money really worth it? No, it's
Is
not.
it? Is it?
It's
That's
not.
what I remember. I remember like sitting on my couch and being like, I'm not even going in. They said they need people. I was looking at the text and I said, I said, even for an extra $1,000, I wouldn't even go. Even
And
for $1,000 a shift, I wouldn't go. That's how much I was burnt out.
yes, and that's what I tell any like sonographers that's coming into the field. I'm like, set your boundaries now. Say yeah, know when to say yes and know when to say no. If you really feel like you really want to get this shift and you want to do it, but also know that you do have to set a boundary and you do. It's okay to say
Mhm.
no to a shift. It's they'll figure it out. And I had to come to terms with like it's okay if you say no. It's okay if you're not there to like rescue the team and save the day. They will figure it out. The patients will be fine. Like you physically and mentally and emotionally cannot handle another day. Like they'll figure it out. It's gonna be totally fine. And I would take like work guilt too. I'm like, oh my god, they're gonna. Oh my god, I don't want them to.
Do without me.
I'm like, I'm sorry, y'all, because y'all would do it to me if y'all had the opportunity to be off. So hey,
Quick.
hey,
PTO and just
be
PTO
gone.
got denied. Prepare the others because I'm
Right,
still not
I'm
coming.
gone. Yeah, I'm like,
You
hey,
denied my PTO. You
I'm
didn't
gone.
prepare the others when I asked you to.
Right.
Sorry to you. Because I think that that's so important to set those boundaries because what we see in healthcare is that if you don't set clear boundaries up front, they will take advantage of you.
Hmm.
They'll stop even at you always pick up the shift, they'll stop asking you about
Yes.
it. They'll just put you on the shift and say, "Hey, I have you on for X, Y, and Z day."
And
And
you're
you just like, "Hold on.
like,
I have an appointment on that day."
I be like, I already had plans, so but ask me first. But and I
They
didn't
get
like,
to
and
that point.
luckily I worked my all my managers that I worked with was super good about like if I needed extra shifts or something like, hey, I can work this day. I mentally prepared myself. So if you want to add me, add me. They wouldn't just add me all the time, but they did. Some of them did kind of stretch those boundaries too in things that they knew I was very reliable. They knew I could get things done. So they would just kind of be like, oh, well, yep, Jessica can do it. And I'm like, yeah, but I might not have mentally, I can't do it. So get somebody else. And I remember the first time I said no to a shift, like my manager like looked at me and she was like, you you sure? And I was like, no, I'm positive. I got stuff to do. I'm good. And she just was like, okay. And I was like, well, maybe next time, ask me in like a couple of weeks and I'll see if I could pick up something. But like setting those boundaries because they just knew, like, okay, she's gonna do it.
Mhm.
She's gonna do it. I can depend on her. And I'm like, yeah, you can depend on me. But when I'm like done and I've made my decision, like, I'm not working this Friday, or I'm not working this shift, or I'm not doing, XYZ. You can't talk me out of it now. Maybe back then when I was younger and didn't know any better, but now
Yeah.
I'm like, no.
Yes. Actually, where is that book? Because I was reading a book about boundaries. Set boundaries, find peace. That is a
Oh, okay.
great book
I'm gonna have to look into
to
that.
set
Yes,
your boundaries
yes.
because I had lacked those in work. I'm like, they need me. They need
Yeah,
me.
right, right. And you're like,
And
patience. I need to help them. I want to
yeah,
help
I need help all the patients.
them.
Like
Right.
you can only be where you are.
Yes.
You literally can only be where you are. And I think the reality is, we as great workers, people feel like, oh, you're a great employee. I'll get you to do it. They allow poor workers to get scot free with not doing the work, and they dump all the work onto those who
Hmm.
do.
Hmm.
So they'll end up burning you out before you even know it just because they've dumped all the work out on you because you are reliable.
Right, right. And that's even like to go back to like ultrasound. I feel like that's one of the things that even in all of the imaging modalities, working in the hospital, like the doctors would like send the patients for, CT or MRI, and then I'm like, everything is in the report that's needed for the patient. And I'm like, okay, but just send them the ultrasound to confirm the finding that was on the CT or the MRI. And you're like,
For what?
why? Why are we doing this? how do we get here? Like, no, it said, why are we doing this to this patient?
To
And
go
now
through another imaging.
to go through another set of imaging that's just going to confirm what was already confirmed before. And that was one of the things that even in ultrasound setting, like getting out of the hospital, because the boundaries of the hospital would just be so,
Oh,
what
lag.
bound what
What
bound
boundaries?
that didn't exist. And I'm like, aren't we supposed, if correct me if I'm wrong, but aren't we supposed to be helping the patients, and doing tests that's medically not necessary is not helping this patient? Like,
Financially or physically.
and we would often, we had one doctor when I first started, he would order like multiple exams, like 4 exams, two on he'll do like artery and veins on arms and legs for these patients that didn't have any symptoms to do these things. And you would ask the patient like, pain, swelling, something,
Something. Give
anything,
me something, anything.
scratch, did, like, let me look at your arms, maybe they're red, nothing. And the patients are like, I don't know why he's doing this. And I'm like, why am I wasting my time doing this for you, or doing this to you, when somebody else is really needing me? So now we're
Yeah.
wasting that resource, and we're wasting our time, and we're wasting the patient's money and their time too, because they're like, well, I want this ultrasound done for this patient before I can discharge them. No, if nothing's wrong, and I'm like, and I would
I
often
mean,
like
look
have
at
to
the
tell the patients,
DBT.
yes, I'm like, I tell the patients, I'm like, dude, if you don't want to do this, we don't have to do this, because they're looking at us like, I don't want to do this. I'm like, your doctor ordered it, so
Yeah.
it's up to you. I'm here either way, but I want to help you, and if nothing is going to, if nothing is, this is not going to change anything. You're still getting discharged. Why are we here? And that was one of the things, like, I was like, I got to get out the hospital. I need to get out
Yeah.
the hospital, because this was definitely like taking my boundaries of helping people just out, way out the window. And I'm like, I don't like it. I don't like it. So going into breast kind of mitigated that.
Yes, and I think what people don't really recognize is that when you have smaller facilities, they can be managed more.
Mm-hmm.
Like they have more of a management because you can't do whatever you want to.
Right.
Like, but in the hospital, it's so big that it's no eyes on all the things that everybody's doing. So people evade following policy and procedure. They kind of just do what they want to do
Right.
without any checks and balances. But
Mm-hmm.
when you go to like a clinic, they might have the Joint Commission in there or ACA in there,
Right.
but ACA is able to see everything,
Right. Right.
you know?
It is, yeah. And it's just it, and that was one of the things that when I first transitioned into the breast world, I was like, wait, y'all have the radiologists are gonna tell the results to the patient that same day.
Mhm.
I take my images, and everybody leaves happy or satisfied. We kind of had a end to what happened with this patient for that day. And I'm like, oh wait, I love this. I'm like, the hospital got to get it together, because it's two totally different worlds. And I'm
Mhm.
like, the patients over at the breast center were usually more happy. They were more patient. They're like, oh, take your time. No, we understand. No, do what y'all need to do. No, we're
Hospital
here.
disgruntled.
And hospital, I'm like,
Everybody
oh,
disgruntled.
y'all just y'all got to calm down.
Sorry.
I'm like, y'all need some outpatient energy over here.
Can you sprinkle a little outpatient energy?
Get a little bit over there. But yeah,
Mm.
it's just so interesting to see how, like, there's no clear boundaries, and that the hospitals kind of just do kind of whatever they want to. And
They
then at the level of like the breast center, we had our radiologists that are very like, okay, what are we doing for this patient? Let's do only what is necessary to do for this patient. I'm like, yes, this is my place. This is what I've been working
Mhm.
for. This is where I belong.
Clinics and outpatient also have like they are more cost conscious
Mm-hmm.
because a lot of the funding and stuff is coming out of their pocket for a lot of the things. So they're always like penny pinching. They're like, we're
Yeah.
not about to have her do that image, and that image costs how much?
Yeah.
Oh no, we don't even need that one.
They'd be
Don't
like,
even do that one.
hold on, before y'all open a biopsy device, make sure it's happening, because how much is this? Yes.
Yeah. What
Yes.
insurance do they have? First of all, what insurance do they have? Because do the insurance even cover the thing
Right, exactly.
in the hospital? In the OR in the hospital, I'm just popping stuff. You get this. You get this.
Like,
You get this.
everybody get it. Whatever. Sure.
At the surgery center that I work at, oh, we need to pop the sutures open as we go. Because the suture costs $40. Okay, $40. This other suture costs $40. We gotta make sure that we charge for everything.
Right, right, exactly. It's such a it's a very different experience, and I think that's one of the things that I do like in ultrasound because it's so much variety. I mean, even just going from an outpatient clinic to a hospital is like a whole different ball game, like a
Mhm.
whole different mindset. The patients are different. The atmosphere, the energy in there is just so different. But of course, it has its checks and balances and pluses and
Mhm.
minuses too. But I was like, give me to the breast center. Like that is where I
Thank
felt
you.
like I was so. I just felt like I was helping more over there because I'm like, okay, I got into this to help people and solve a problem. I'm really solving the problem doing breast ultrasound at this point.
I'm glad that you specialize. So, what all specialties do you have as a sonographer?
So I have my registry in abdomen, which entails like doing liver, kidney, gallbladder, like abdominal ultrasounds. I also have OBGYN, so I can do, pelvics for our just uterus, ovaries. I can do babies. I definitely do not like doing babies. Not my fave. Not
Mhm.
my fave. But I'm certified to do it, just not my fave. But yeah, so that's pretty much all that my specialty encompasses. I do know how to do like check the veins in the legs for like blood
Mhm.
clots and DVTs, carotid arteries, thyroids in the neck and things like that. But it's also other specialties of like heart ultrasound, echoes, MSK that I can do a little bit of, not heart, but
Mhm.
like MSK and things like that for looking at like ligaments and the muscles. I can kind of get away with looking at those things, but those are its own like specialties.
So, what does it take for you to get specialized? Because I know you said it's a registry. So,
Mhm.
is it kind of like a fellowship? So you have to specialize in the different groups and then go get certified?
So with it, when most ultrasound programs will teach you like everything. And within that scope of what they teach you your ultrasound schools have to be it's called KHET, so they have to be certified through this accredited body. So when you have your ultrasound programs that are accredited through KHET, they're supposed to teach you certain things in their curriculum in ultrasound school. Once you go through the program, then you can go ahead and sit for any modality that you or any specialty that you want to take. So like when I graduated, I went ahead and took my abdomen first, just because at the time that's what everybody was kind of just needing to get into, like just an entry level position.
Mhm.
So even before you go into working, you can sit for your registries and have some registries already under your belt. Because like even in vascular, it's called RVT. They have to be the sonographer has to be certified in RVT before they're able to do those type of exams under those certain hospitals sometimes. So you have to kind of get your certification first and then start working. Or if like me, I my last clinical rotation, I was actually hired on as PRN, so I actually got to do my registries like while I was like still in like the first couple of months of me actually working with them.
And I think that's important too. Like you said, get into the hospital first
Yeah. Oh, yes.
because all of the educational opportunities that you'll come in contact with, like getting your registries or getting different certifications or figuring out something else that you want to do.
Yeah. And I think one of the things, and I say this all the time, especially working in breast and seeing how when we get newer students that might not have had that hospital experience, they are missing like a critical thinking piece of healthcare.
Mhm.
That is like you don't in the hospital setting, you're on call, you at night shift by yourself, like you have to kind of just figure things out by
Mhm.
yourself as you go. And I always tell our new techs, I'm like, hey, I know you might not want to work in the hospital, but trust me, that is the most invaluable experience that you will ever have. You will learn how to work with others. You will learn how to work in a quick, fast environment, a changing paced environment. If you're there like at nighttime or by yourself, you might have to figure out how to fix the printer in the middle of the night.
Yeah, how do you? You
Yeah,
don't know.
exactly. Because it actually happened to me. Like on call,
Yeah.
the printer wasn't working. I'm like,
The
is
printers
this,
are
is
always
this
like,
what? I'm like, I'm trying to figure it out. But like once I like got it, I'm like, okay. If I can figure out how to do a printer in the middle of
You
the
figured
night
out
or in the
anything.
morning, I can figure anything. So having that experience in the hospital, getting that, and I think that's where you really hone in and kind of learn that patient care and
Hmm.
what's okay to say and what's okay to do, because the hospital, you're going to get a little bit of everybody and you're going to have all these different emotions. And in outpatient, you're going to have like your patients 9 times out of 10 in outpatients are going to be anxious, they're going to be stressed, and you don't have a patient that's at a non-stress time. They're all going to be
Exactly.
very anxious and like, what am I doing? Oh my god, y'all see something? Oh my god, I'm about to, this is the end. And I think being in that, they do. They're like, am I dying? And I'm like, I
I don't
mean,
know.
no, I don't
I don't think so. At least
answer
I'm
that.
here.
Yeah, I'm like, well, I mean, in a way, we kind of all are, but as of right now, I don't know. Like,
Yeah.
it's very, and I think that's why I learned so much, like how to interact with the patients, because they would just say at the hospital, they would say like the wildest things, and you're like, how do I
And you
respond to
see
this?
the wildest things.
Yes. Oh, yes.
And
Yes.
you see the wildest things because, baby, the OR, I know y'all saw the image before we saw it. I know y'all saw the image before we saw the image.
Right.
So,
Right. Right.
so tell them what you're gonna run into at the hospital.
Yes. Yes. But it makes you, I think it made me not be afraid of the out of the ordinary things that
Mhm.
were going to come up. Because if you tell me like I have seen some pretty wild things breaking in the breast clinic, but if I hadn't had that experience at the hospital, I don't think I would have been mentally prepared to see and deal with what I saw at the breast center or what I see at the breast center. Because I'm like, oh, this is really bad. But I'm also like, well, at the hospital, we had this really bad situation. So now I know what to do. If I see like
Yeah.
a open wound, how do I prepare the probe? How do I, prepare the patient and say, okay, I'm gonna work around this area. Let me get the sterile gauze. Let me get the sterile gel. Let me make sure I'm cleaning everything. If I didn't have that experience at the hospital, I don't think it would have really translated well over into the breast clinic.
Yes, critical thinking skills, ladies and gents, because that is important and that's something you have to learn. It does
Mhm.
not come overnight.
Mm-mm.
That she's been doing this for 12 years. Okay?
Yes, it
And
took a little practice. It was a little trial and error.
And I feel like people beat themselves up for not having critical thinking skills when they first get into a field. And the reality is, unless you're like thrown into the wolves,
Yeah,
it'll take a while to develop those critical thinking skills to know, okay, so what am I doing? How quickly can I do this?
right.
Okay, am I doing everything streamlined
Mhm. Mhm.
or am I all over the place?
Right. Right.
Because you could get into some situations and that situation will have you all over the place. You don't know what to do.
Right. And then you can't, and once you in the state of like panic and your mind is all over the place,
Mhm.
you can't bounce back to like, okay, now I'm back to a normal
No.
kind of workflow. And that was something I think that, I had to learn. I'm like, oh my God, I'm always like chaotic. But then I'm like, okay, I'm chaotic now in this with this patient, but okay, flip the switch. Okay, now I'm calm and cool
Yeah.
collected with my next patient. So it's very like it's super important. And
Mhm.
it was trial and error, and a lot of times, especially with ultrasound things, it takes time and patience. I tell my students all the time, like, patience is not going to happen overnight. I doubted myself a lot, but once I knew it and I felt like I had it and I trusted
Mhm.
my gut and knew that I'm like, no, I don't have imposter syndrome. I know what I'm doing. I got this. But I will say, and we've talked about this on our sonography groups. It's like, when was it that you knew what you were doing? I'm like, oh, probably like year 10. Year 10
You're
is when I
10,
was really like,
definitely.
I really got this now.
Exactly.
Like I
I can
really
say,
got
like, the first year, I thought I had it. And it's studies that show this. The first year, you always think that you have it. And then by the time you get to, like, that 6-month mark after that first year, you're like, "Hold on, I don't know what I'm doing."
yeah.
Like, I've just been out here just doing stuff. I don't know what I'm doing. I
Basically.
don't know what's going on.
I remember we had like it was a Saturday, and it's always weird stuff that happens like on the weekend or at nighttime. And the guy came in and they was like, "Oh, Rulite, a ruptured Achilles tendon," and I'm like, "What? How do we? I don't think that's us. Like, I think that should be like an MRI or something. But it's the weekend. MRI is gone. They were gonna have to
It's
call in a
you.
tech, so they were like, "No, y'all can do it." I had to go to my radiologist. Like, what am I? What am I? I don't. Can you draw me a picture? What am I supposed to look for? He was
Yeah.
like. This was his words exactly. You'll know it when you see it. What? I don't think I will, because I didn't learn this in
What is
school.
it?
So I was like, what is it? So I had to Google it. I was like, ultrasound pictures of a, and I'm like, oh, okay, no, okay, I got it. And sure enough, that's what it was. But if I had, I'm like, I don't, how do y'all figure I know what to do with this? Like,
What?
I don't think we the people,
We're not the people.
right? We
We
not the
can't
people.
be
I think
people.
it's somebody else. It's not, I don't think this is an ultrasound problem, because what, sir? And when the radiologist told me, you'll know it when you see it. I'm like,
You knew it when you saw it.
I did. When I was like, oh, okay, yeah, he's right. I did know when I see it. Okay, now it makes sense. But it's those little stories and little things and experiences where I'm like, that's where that critical thinking and all of the
Hmm.
things that I learned got me to this point. Because if it wasn't for those weird one-off things that, and I've never seen it ever again in life. But if it wasn't for like those moments, I wouldn't have gotten to the point of like, I'll know it when I see it. And that's one of the
Right.
things that I started to kind of live by. If it's something wrong, you'll know it when you see it. And I'm like, okay, and trust that you'll know it when you see
Hmm.
it.
Like now you are your radiologist.
Basically, I'm like, the
You
patients are
know
like, I'll be like, oh yeah, I have to talk to the radiologist about it. But in my head, I'm like, I'm really telling them what
when
they
the
gonna
student
come in
has
and tell
become
you.
master.
So like, basically, I could just tell you what they said, because really, I'm just sitting here to be like a second hand person here. So
Exactly. But I have I got to get on this meeting with my
yes, okay,
classmates.
no worries.
But I want to first of all say thank you so much for
Thank you.
coming onto this podcast,
Thank you for
because you did
having
not have to come on here, but you did, and you shared so many great stories and so much information. Now I feel like I want to become a sonographer.
Listen, hey, it is fun over here. I will say it is fun. It's fun over here. It's really a vibe. It's a time. It's a lot of hard work, but I feel like if you can do nursing school, you can do this. Like, hands down, you can do this.
So where can our listeners find you?
Yes. So I'm on Instagram and TikTok at Sono Girl Jess BR on Instagram and TikTok.
And all her information will be linked in the comment section. And then I also want to say that she offers mentorship and she offers courses.
Yes, I do
Okay.
courses.
She has one that registration is closed now, but she has one that's coming up after that. So when is that, Jess?
That is going to be, I believe, middle of July. We only have one. It's going to be one in July and then one in October, and that'll be it. And it's in person. It's at a healthcare education center here in Houston.
Mhm.
So you would have to come into Houston to do the course and register and everything. But the course is small. Any mammographer, physician, if you're a nurse that want to get into ultrasound, you can do the course for breast ultrasound and kind of see everything and kind of learn it.
Again, thank you so much.
You no problem. Thank you for having me on. I really appreciate it. I love, like I said, I love everything that you're doing, and I support you 100%, because I was
Thank
like, oh my
you.
god, I love this. This is so good to like have a space to for us to kind of talk and be candid and open about the things that's going on in healthcare.
Yes, and thank you so much. And with that being said, y'all, make sure that you go and follow her on all social media platforms. And she already let you know that y'all can reach out to her.
Yes,
So if you have any questions about sonography, ultrasound, imaging, reach out to her. And if she doesn't know the answer, like she said, she'll get you in contact with somebody who does. And this is where we need to start networking, because there are certain questions that you have that you're just too afraid to ask, and it's important that you ask the questions.
yes,
Get into my DMs in my LinkedIn, wherever you need to find me. Find me if you have any questions. I'm always open and willing to do that, and she is as well. So go down into the comment section and get in contact with her, because if this is something that you want to do and you want to get into healthcare, you don't want to be a nurse, you don't want to be a doctor, and you find that this is something that you want to do, that you will be passionate about, definitely do that. But
yes.
with that being said, I hope y'all have a great day, and bye.
Bye. Thank you. Bye.